debate over health care reform in America. It's a topic that everyone is talking about or sometimes yelling about.
Everyone has an opinion on this one. CBS 4 political reporter Michael Williams is spearheading our week-long commitment to help you understand the health care proposals.
Yeah, Michael joins us right now with two South Florida lawmakers in the middle of the debate. And Michael, something tells me we're going to hear two very different points of view on this.
Respectful, but yes, different points of view. I'm joined by Weston Democratic Congresswoman Debbie Wasserman Schultz and longtime Miami Republican Congressman Mario Diaz-Balart. Let's jump straight into it. I know in talking to you over the last many months and indeed years, both of you agree that we need health care reform because of soaring health care costs in this country, and you agree generally on the need for expanded coverage. That's where the views diverge, but we both agree on that as you sit here right now, correct?
Right. Absolutely.
You think a public option is a centerpiece to health care reform. Why, especially when you hear so many Americans right now who say they don't? Why is it crucial in the mind of Democrats?
The public option is a crucial piece of health care insurance reform because the private insurance market right now is totally and completely profit-driven. We need to have a public option operating side by side with the private insurance market to make the whole system more competitive and to drive down health insurance costs.
But what keeps the public insurer from driving them out of business? If everybody says I can get it from them, I won't need my private insurer, or they say, or an employer says, don't need it anymore.
That's simply not going to happen. You have millions of people who like their insurance now. They have good insurance coverage, but they just want it to be more affordable. The private insurers will naturally, with a competitive public option, lower their costs, and they'll also, under our plan, not be able to drop people or not insure them because of pre-existing condition. They'll not be able to charge lifetime or annual caps. The health insurance is going to be portable. Those are all elements that are key to health insurance reform in addition to the public option.
Congressman Diaz-Balart, you strongly disagree. Why doesn't a public option work in the minds of Republicans when many people complain that their insurance costs from the private insurers are going up and up and up? And if you don't agree with it, what's the alternative?
The insurance is going up and up. Look, saying that the only way that you can have competition is by having the government have a company, let's take it a step further. Then should the government have government-run gas stations, government-run contractors, government-run supermarkets?
What are the options?
And we laugh because it's ludicrous. The option is real competition. Some key things. I agree that there should be portability. You should own your insurance. Large corporations get tax breaks if they provide health insurance for their employees, but individuals and small companies don't. Why not? You and I can get on the internet and purchase car insurance from a lizard in Virginia, cross state lines, but we can't do that with health insurance. Why not? So there are government impediments to real competition. So the problem has been government. Creating a government-run health insurance. Look at the experience that Florida has with Citizens. Look, if you're happy with being in this state-run insurance policy that now is the only game in town, and it wasn't created for that purpose. And then fine. The reality is it would create a monopoly, a government-run health insurance, and that's not the answer.
That's comparing apples and oranges. We have Medicare, that senior citizens would not have health insurance coverage. They didn't have health insurance coverage, and they slipped through the cracks before we passed it. Republicans opposed that. TRICARE, Veterans Health Care Insurance, works very efficiently. Both of those programs are government-run, and no one argues that those are good programs that give comprehensive coverage in the best possible delivery format.
And this is not the time to cut $500 billion out of Medicare, which is what the proposal. The proposal in the House cuts $500 billion from Medicare, which
from
is care
providers, not from the benefits for senior citizens. So don't be disingenuous about what.
No, it's $500 billion.
From providers, not from benefits.
And there is a distinction, which the debate will go on. But let's listen to a few viewers I talked to recently about one of the chief concerns I hear again and again.
How are we going to pay for it, and how am I, as a physician, going to get paid?
I think my number one concern is paying for it. How are we going to pay for it? Who's going to pay for it?
Increased taxes would be the biggest concern because we've been promised that we would not have our taxes increased.
Cost. Again and again, people don't trust the government to make this work. How are we going to pay for expanding health care coverage to 40 million plus people and bring down costs at the same time? They don't trust government to do it. You heard it. They're worried about their taxes going up. What do you Democrats say?
Well, for the last 8 years under President Bush, nothing was done. There was nothing attempted. And clearly, healthcare costs have eaten up more and more of our economy, and we have to do something. The bottom line is that 2/3 of our proposal would be paid for by dealing with the waste, fraud, and abuse in the healthcare system. Another 1/3 would be paid for by a health care surcharge on 1.2% of the wealthiest Americans, people who make more than $350,000 a year.
Congressman Diaz-Balart, do the numbers add up in your mind?
Only in Washington can you say that you want to save money to the government and to the taxpayers by increasing the expenses by $1 trillion. Look, that only happens in Washington. Common sense will tell you that if you're spending an additional $1 trillion, you're not saving money.
What's the option then? Because the other argument is that ignores the debate about doing nothing, which also will cost employers more and taxpayers more. So again, what's the option to that?
The option is to allow for real competition. The option is to allow for small businesses to get together and to purchase as large businesses do, to allow consumers the same tax cuts that large companies have, to allow for competition across state lines, and I mean, so there's things that we can do without destroying the good things, which would lower the price of health care, absolutely lower it, and have a good quality health care system, not a government-run health care system.
Hold your vague comment, because I want to hear from our viewers one more time, because they talk about concerns that go to your argument that some of this, in your mind anyway, is vague. Let's roll the tape on that.
I'm lucky enough to be insured through my employer, but I have had times when I did not have insurance, and it's very scary.
How are they going to ensure that as changes are made in the program, that rationing doesn't get to the point that people can't get insurance or get coverage that they need in a timely way?
Well, my biggest concern is who is going to handle this, who's going to be on top of this, because I don't want any price, to go up after maybe 1 or 2 years.
People worried if we get the program, it'll become bureaucracy. Others, Congressman Diaz-Balart, worried that they'll be without. Quickly, final comment. Do people have to worry about rationing? And why shouldn't they be worried it'll be more bureaucracy? No. Closing comments.
We'll cover 47 million Americans that don't have health insurance, and we will, more importantly, drive health care for small business owners who can't afford to provide their health care any longer, and for individuals who can't get coverage because they have pre-existing conditions.
Closing comments.
Sounds good, but CBO has said that it would increase the cost on individuals, on family members. It's going to cost the taxpayers and the government about $1 trillion in increased money for health care. We need to fix the problems, not destroy what's still working. There are bills out there that we're ready to go on if they'll allow us to debate it in Congress.
And we will have to leave the debate right there between Congressman Mario Diaz-Balart and Democratic Congressman Debbie Wasserman Schultz. Now back to you, and our coverage continues later.
Michael, thank you.